So one of the things that we hear is intermittent fasting. What is the evidence and its benefits for cancer patients?
So intermittent fasting, it's currently being looked at by the scientific community, and there are some studies that looked at intermittent fasting and cancer. So some of the results are mixed, and when I looked at the evidence, they actually suggest that before you conduct intermittent fasting, you need to be a little bit careful. So, for example, if you're already underweight, then intermittent fasting can potentially increase the risk of malnutrition. And we know the malnutrition is linked to your immune system, which make your immune system weaker. So I think that there isn't enough research at the moment to make sure that we can recommend these intermittent fasting as part of your treatment, either chemotherapy or immunotherapy during kidney cancer.
The other thing that we are finding more about is obviously we're talking about eating less protein, and more of the population are becoming vegetarian and vegan. So would those diets suit kidney cancer patient, whether they were on or off their treatment?
I would say yes. If you are a kidney cancer patient and you follow, or you want to follow, or you were following a vegetarian or vegan diet, there's no reason why you should stop that. The important things is that, again, you go back to the healthy, balanced diet. So yes, you will have your vegetable there, your fruit, but you need to make sure that you also have your protein sources. And you can do that in a vegetarian or a vegan diet. But with vegan, I think the only reservation that I have is that you're slightly higher of becoming vitamin B12 deficient. So vitamin B12, it's a vitamin that you get a lot from animal sources. If you are vegan, then it's something that probably you would want to check maybe once a year. You can ask your doctor to do that.
It's suggested we need to take care when eating protein, but if you're looking to lose weight and also do some weight training, it is recommended to eat protein. What are good sources of protein, and how much should we eat in a day?
So generally speaking, the WHO, so the World Health Organization, recommends a protein intake 0.78 grams of protein per kilogram of body weight. If you have a kidney problem, then in some patients, a high protein diet is not recommended. However, we need to think about that obviously a person with kidney disease may be actually different from a person with kidney cancer. As a rule of thumb, I would say having a healthy balanced diet means to have 0.8 to 1 gram, up to 1 grams of protein. I think we go back to the value that I said before in our previous session, where at what level would you consider to change your diet? We said about if your kidney function is less than 30%. So if your GFR is less than 30, then yes, you should probably worry about protein and do not exceed 0.8, maybe 1 in some cases. But if your renal function is very good, and by that I mean 40, 50, 60%,
okay,
then I wouldn't restrict your protein intake. The last thing is also, if you do weight training and you want to build a muscle or lose weight, you can do that with following normal natural sources of protein. But I would discourage you for the use of, for example, creatine supplements, because essentially you may put extra weight, the kidney will have to deal with it.
Okay, another question that patients will hear is, avoid tomatoes, but they are such a core ingredient in so many recipes and salads. So is this true? And is there a way that you can bring them into your diet but look after your kidney function at the same time?
So the confusion here is not if you've got kidney cancer or if you've got kidney problem, you need to avoid tomato or limit tomato. That's not the connection. The connection is if you have a high potassium, which most people with kidney cancer, actually their potassium will be fine, will be normal. If you have a high potassium, then you may need to consider to limit the tomatoes, but not to avoid.
Something else that we get asked is it okay to take vitamins and supplements? Are there any additional supplement vitamins which you think will help patients stay as healthy as possible?
So overall, I would say if you follow a healthy, balanced diet, there isn't a need to take an additional multivitamin or vitamin supplements. I think the only exception is probably vitamin D. So Public Health England recommend the general population to take vitamin D supplements during the winter month. But I think if you've got a kidney problem, you need to be a bit careful. So, for example, some of the vitamin accumulates in people with kidney problem. For example, vitamin A. So having a general multivitamin supplements, you may think that would be too good to you, but actually if you've got a kidney problem, I would be extra careful. The other consideration is that some patients ask me about herbal remedies, and actually a lot of the herbal remedies and vitamin supplements, they get excreted by the kidney, so you may increase the workload of the kidney if you start to take those. And the very final things is some herbal remedies or multivitamin supplements, they may actually interact with some of the drugs and medication that you're taking. So my advice that I give to any people with kidney cancer, but also with kidney problem, is always, if you want to do something like herbal remedies or multivitamins, always speak to your oncologist or to the nurse or to a dietitian.
Yeah, okay. One of the other questions we get asked is, I've been told that I need to avoid red meat. Is that true?
So there's a lot of press about red meat, and particularly there's been a link with red meat with a type of cancer, colorectal cancer particularly. And it's not just red meat, but it's also processed meat. So meat that has a lot of additives or it's been processed, particularly with nitrates. So ham, for example, is one of them. So the healthy guidance is probably to limit the amount of red meat. So for red meat, we mean pork, we mean beef, we mean lamb, for example, but also limit the amount of processed meat.
We hear a lot about fad diets, such as the keto diet. Are these safe for patients with one kidney or a poor EGFR, or if you're on kidney cancer treatment? Would you recommend that our patients would go on something like that?
So a keto diet, it's a diet that's very low in carbohydrate and higher in fat and higher in protein. So the keto diet goes a little bit against if you've got a poor renal function. So it's something that if you've got a renal EGFR of 30 or less, I would probably not recommend that. Okay. Because essentially what you're going to increase the protein provision, and especially if you go above the threshold of 1 gram per kilogram of body weight, then there's a potential risk of get the proteinuria worse, or increase blood pressure, or cause damage to your kidney in the long term. So I would probably not suggest a keto diet if your renal function if it's less than 30.
Another type of diet is the BRAT diet, or BRAT. What is that? So
the BRAT diet, I think it used to be quite common in the past, and I think it stands for banana, R is for rice, applesauce, and toast. And it's a diet in the olden days that used to be suggested especially by nurses and doctors when people felt very unwell. So when you had diarrhea or vomiting or nausea or during specific treatments where you felt unwell. And essentially it's a diet that is classified like with simple food or very plain food. Try to have plain foods like toast, bread, or rice because they're better tolerated for the GI tract. There's not much scientific evidence to support this. So it's whatever you can tolerate. There's no harm to follow a BRAT diet for a few days. But if you need to follow this for a long period of time, like more than 3 or 4 weeks, then you're likely to have some deficiency, so we will not recommend it. So time is of essence.
And our final question is what are the best websites to read about renal-friendly diet if you've a low kidney function and you've defined that low as 30 EGFR and below? So are there good websites that we can go to look for recipes and things like that?
Yeah, so there's 2 main websites in the UK. They're both run by UK charities. So Kidney Care UK has developed, I worked with them quite a lot over the past 2 years, and they developed Kidney Kitchen. So they've got chef, they've dietitian, renal dietitian. They actually develop a lot of recipes. But remember, these are recipes particularly for people with kidney disease, so very, very low renal function.
Yes.
So 20, 15, or even people on dialysis. I will always stress, actually, people with kidney cancer, if you've got renal function more than 30, like 40, 50, 60, 70, then there isn't necessarily a need to follow those diets from the Kidney Kitchen website. The other website, which is a charity that's very similar to yours, where it's run by patients for patients, is the National Kidney Federation website. There's two. One is American, so ignore that. It's the UK one that you want. Those would be my main two websites to go, I would say, Karen.
Brilliant, Bruno. Today you've given us fantastic insight into the difference between a kidney cancer diagnosis and low kidney function. And I think it's really cleared that up for patients. You've also given them the opportunity to understand better the types of food they should be eating on a healthy diet. You've also kindly offered to give us a fact sheet with all the information we've discussed today, which will be on our website. So all that is left to say is to say thank you very much, Bruno, for your time and helping us with this and helping us make this Ask the Expert video. Thank you.